I just want to say welcome to everybody and remind everybody that the American Anthropological Association is having their meeting. It's a hybrid meeting in November. And if you want to just participate virtually, it's a really inexpensive registration fee. I don't remember what it is, but it's really not much at all. So you still get to see your friends.
Virtually.
Way.
Yeah.
Okay. Anything else we want to announce, Martha, in terms of upcoming stuff or anything?
I just want to let everybody know that there's a lot of work going on about practicing anthropology between me and Pamela Rao and NAPA, and also and the AAA and the European, I can't remember, EASA, and I forget what it stands for, the European Anthropologists, the Applied Practicing Anthropologists. There's going to be a conference meeting, whatever you want to call it, on the 16th of October. Unfortunately, it's already full. It seems like it filled up in 24 hours. So I'm telling you this, but if you're not registered, you can't register now. But this is going to be a series of ongoing things. We're trying to build a relationship internationally. And so the anthropologists, at least in Europe and North America, can talk to each other. So this is just the launch, and there'll be more to come. And I will hope we will get the information to you early enough that, or we find another Zoom host that has the bandwidth to the capacity to have more people participate. So just know that there's discussions, and that's a happening thing these days.
Great. Anybody else, anything else? Martha, anything on upcoming events? You're muted.
Sorry. Just stay posted. We have programs on the treatment of artifacts, returning them to their proper owners coming up, both in Syrian, Eastern European, and also native indigenous artifacts. And there will be programs related to practicing anthropology. It's going to be a really full year. So stay tuned.
The Washington Post had I think it was at least 2 pages on the problem of artifacts not being returned from many national museums, Western European museums and American museums. So that's a big topic.
Yep. So stay tuned.
Stay tuned.
Thank you. Well, for those who don't know me, I'm Joanne Schneider, and I am part of the program committee and have been doing applied and, well, evaluation anthropology before it professionalized, actually, in the way that it has now. So we have a wonderful set of speakers lined up, and I think we should probably get started about now. And we also have a wonderful set of folks listening, half of which could be on this panel themselves. So I'm hoping that we can have a lively discussion. So on that note, let me introduce our first speaker, who's Mary Odell Butler. And Mary is currently an adjunct professor at the Department of Anthropology and a consultant for anthropology at Maryland College Park. Mary's PhD is from, not finding that, okay.
Temple.
Temple. I didn't know you were Temple. Yay, Temple rules. I'm another Temple person.
Are you Temple? No kidding.
I am. I am.
I got the third PhD that Temple gave out.
Oh my God. Okay.
It was the Wild West, I'm telling you.
Yes, it was an entirely different department.
Yep.
Conversation for another time. But Temple was a wonderful place to be. And anyway, Mary's expertise is in research design, methods, management, and supervision of public health projects. She has published several books, including Evaluation, A Culture Systems Approach, and co-edited Scholar Practitioners Addressing Global Issues, and papers in that. She is currently elected member of the Programmatic Advisory and Advocacy Committee of the American Anthropological Association. She has special expertise in program evaluation research, and qualitative mixed methods with an emphasis on linking findings into both quantitative and qualitative evidence, i.e. multi-methods, which is what we all, I think, do now these days, and did many program evaluations for CDC during her employment at Battelle and Westat. She has conducted numerous workshops on evaluation, case study methods, mixed methods, and careers in anthropological practice at professional meetings and in academic venues. She's also teaching at in graduate school courses in evaluation anthropology and applied anthropology at UMD College Park. And she's going to talk to us today about reflections on evaluation anthropology. And Mary, I'll turn it over to you.
Thank you, Joanne. Wow. I'm impressed with me.
We are too.
Yes.
Okay, I would like to start out just by doing a few definitions so you'll know what the terms I'm throwing around mean, although I suspect that many of you are more familiar with these than I am. Then we'll talk about my career, which is kind of interesting because I was one of those frontier people. It was like I started out to live one life and then the world changed and I wound up living another one. And looking back, I'm very satisfied with what happened, but if I had looked at my career from the beginning, I would have been terrified and probably appalled. What is evaluation? You can argue that for days. Basically, it's a scientific study designed to assess the value of something. A program, a policy, a project, any kind of an initiative, and report the results to someone who uses the results of the evaluation to implement something. So it's active practicing research. Evaluators come from many, many disciplines, as I'm sure many of you have discovered, and they do many kinds of studies. Some do studies to support program design, the so-called formative evaluations. Some of them do things on the accuracy of implementation and the outcomes or impacts of the subject program. And I will tend to slip into programs because program evaluation is what I did, but try to remember that there are many other things besides program evaluation. What do evaluators do? Evaluation is the science of people's knowledge, attitude, and practices of some organized activity. Some work for government, and some work within private companies. Some people work within organizations like voluntary organizations, professional associations. Some work as private entrepreneurs, which is what I'm doing right now. They do scientific design, data collection, analysis, reporting, or critiques of all of the above. Often they generate data-based recommendations for the next thing people do with their projects. My career. When I went to graduate school in 1970, much of the world that anthropologists live in today did not exist. I went through a traditional 4 fields department. And frankly, my professors didn't have so much hope for me because I was a woman. Yes, I lived in that world where it was a disability to be a woman. But like very few of us in 1976, I got an academic job. Academic jobs were as scarce as hen's teeth in the middle 70s. And boy, did I love my job. Oh, I was so happy working with students and doing research once in a while. And just being in that atmosphere was everything I'd ever wanted. 8 years later, I got denied tenure. There I was on the street, an unemployed assistant professor of anthropology. I knew a whole lot about human evolution. I knew a whole lot about the Trobriand Islanders. I knew a whole lot about a lot of really useless stuff, or at least useless to me at that time in my life. What do I do next? I had no idea. I had no exposure to non-academia in graduate school. It just didn't exist. Nor did I have any at Virginia Commonwealth University where I was teaching. Nobody ever talked about that stuff. It was like, if you talked about it, maybe it would happen to you. I had not a clue to what anthropologists could do that wasn't academic. The first job I got after 8 months of unemployment was as an economist. It was a small company, and they needed someone who could do economics and who could do ethnography, although my boss never admitted that. I did a lot of it. In the economics job I did, I picked up enough economics doing my dissertation to handle this job. I did cost avoidance studies for social welfare programs, AFDC, which you probably don't even remember what is. The Office of Child Support Enforcement was a big deal at that time. And while I was doing it, I had a lousy SAS programmer. And I'd done a little SAS at VCU. So I had to check all of his work to make sure it wasn't wrong. And in the process, I became a pretty good SAS programmer, which is a good thing because my next job was as a SAS programmer. After 6 months or so on the programmer job, somebody noticed me and they noticed my PhD and I became a project manager. This was kind of what anthropology was like in those days. I mean, there was no sense of a professional destiny that you would live if you didn't have an academic job. In 1988, I got a job at Battelle because a friend of mine from my programmer job had bid me on a task order contract. Task order is governmentese for a whole bunch of projects that are under one contract mechanism. This task order contract was with the Centers of Disease Control at that time. I guess now it's the Centers for Disease Control and Prevention. I was deputy project director. It all looked really very good on paper, but I knew nothing about evaluation. I mean, nothing. I didn't even know what it was. And my third day on the job, me and the project director were supposed to go to CDC and brief them on the project. I didn't even have time to read up. I got a colleague to explain what evaluation was and how it might look for CDC. And armed with this information, he and I, the project director, went to CDC, and it went okay. I mean, he was a project director, so he did most of the talking. And, all I had to really do was look intelligent. Over the next 20 years, I took part in dozens of CDC evaluations, in addition to a few other ones for foundations and other government agencies. Dozens. I did projects. I did site visits to every single state in the union, except North Dakota, which is okay. I did evaluations in 4 foreign countries. If the project was in Spanish, I got to do it because I had done my fieldwork in Guatemala. It was an amazing job for an anthropologist, absolutely incredible. CDC is staffed by MD PhDs, and MD MPHs, Masters of Public Health. And the MPH in them, which they had gotten the most recently, normally, told them that all truth was in numbers, that if you couldn't get it into a Punnett square, it wasn't important. But under every single one of them was an MD who had been trained in medical school to understand that if you have seen one project, if you have seen one case of something, you have seen one case. Never address a case with the presumption that you know what it is prior to doing the diagnostic evaluation. They loved anthropology because it was emotionally gratifying to them if you could do it in a technically sound enough way that they believed you. And that happened. I mean, me and actually Martha as well, kind of developed a pretty good scientific approach to evaluation using an anthropological paradigm. And they were crazy about it. They really loved it. The Battelle job was a success for me. I was in a place where I could grow as an anthropologist, and it provided interesting work. My job was to design evaluations, go out there and hunker down with the folks and find out what they thought about programs, write it up, make recommendations for program improvement. It was perfect. I did my best work as an ethnographer doing evaluations for CDC. And I learned evaluation and became a much better ethnographer simply because I had done it so often. I mean, during busy periods, we probably did 2 or 3 site visits a month on different topics. So it was incredible. And I became a good multidisciplinary scientist. I learned none of this in graduate school, not even a hint that this existed. Even though I used my education as an anthropologist every single day. What do you need to be an evaluator from a skill standpoint? Good data collection, analysis, and reporting skills. The stuff you did in graduate school. Yes, it is useful. Comfort on multidisciplinary teams. This is a requirement of most anthropological practices, and you probably all know this from your own experience. Teach your partners, and above all, let them teach you. And finally, you need a working knowledge of statistics. Sorry, but you really do. Many people turn pale when I say this because statistics is very scary to many people. In fact, I know many people who became anthropologists so they wouldn't ever have to do any math for the rest of their lives. But the fact of the matter is, you need to be able to talk to statisticians. I was a pre-med major as an undergraduate, which was kind of quantitative. And I learned statistics on the way with a lot of self-study in the workplace. I did it the hard way. You don't need to be a statistician. But if you can't understand what your statistician partners are doing, it can be a big problem. For many evaluation jobs, everyone should pick up a basic parametric stat course. And if you don't want to know what parametric statistics are, ask somebody. I used to check on people's statistical preparation and job interviews that I did, especially if the job interview was with an anthropologist. And they had to convince me that they were comfortable enough with numbers to do evaluations. To see why this is so important, my own studies were often mixed method studies, and I suspect most of yours are. That's pretty much what evaluation has turned into in these days. So these are studies with a qualitative and a quantitative component. However, the definition of mixed method anthropology or anything else is that you have a qualitative component here, a quantitative component here, and they address the same thing. Otherwise, it's just a bunch of multi-method stuff, which is fine. Sometimes you want to do that. But for a true mixed method study, you got to develop the protocol with a single set of study questions. And you cannot possibly design a mixed method study without understanding what the quantitative side of your study will do. You can have somebody else design it. You can have somebody else do the work. But if you don't understand it, it's a bummer. So my last request was to describe a study. Martha, I'm going to talk about syphilis in the South because it's simple enough to get in this much time. CDC had noticed that there was a rise in syphilis in the southern states over several years in the early 1990s. And they wanted to know why. I mean, things had been fine, going along even, and then all of a sudden there was a spike. CDC had a few hypotheses, but they're well enough trained as scientists to know that hypotheses are not the same thing as data. So they came to us. By way of background, syphilis must be reported by both public and private providers to their state health department. And the state health department compiles that data and looks at syphilis in the country. So, you know, and most people, most poor people, or even low-income people, low middle-income people, get their STDs treated at publicly funded STD clinics, which are located in communities all over the country and supported by a grant from CDC and administered by state health departments. We did statistical analysis. We had the surveillance data from CDC, but that's usually just a count of cases and where they are. So we looked at the age and gender distribution of cases by month, was what we used, but others would use different ones. How many people showed up at STD clinics for treatment of syphilis, and how did it change over time? And that's what the statisticians did. That was out somewhere else. We chose 3 states in the South. Martha, can you remember which ones they were? South Carolina was one of them.
We paired up. We actually paired up some cities. So we had Memphis paired up with Tunica, Mississippi. So it was kind of like that. So we had Mississippi and
South Carolina and Arkansas. Was that the other one?
Yeah, Arkansas.
Yeah. At that time, Joycelyn Elders was was head of the state health department in Arkansas. Anyway, so we looked at the age and gender distribution. We got the quantitative data. We chose 3 states in the South and sent in field teams to interview staff and patients about the situation, their own ideas about what was going on. We did some focus groups with patients, usual ethnographic stuff, but focusing on factors known to affect the transmission of syphilis and the seeking of treatments for it. Oh, it's out of time, but I'm almost done. Okay. Then we analyze the data using both quantitative and statistical software. The result, there were, of course, multiple causes for the spike of syphilis in the South. But by far the most impressive one was widespread distrust of the public health system among African Americans populations in the South. This was probably from their own experience with health departments. Health departments of the South don't treat people of color much better than they do anyplace else. But the reason they gave us was the Tuskegee syphilis study. That they were afraid to go near a health department because if they did, they were afraid they would be unknowingly placed in a study that would damage them, harm them. I ran into a public health guy recently within the last couple of months, and he told me that this is still the case. Now, the distribution of the syphilis, the outing of the syphilis of the Tuskegee study happened in the early 1970s, 1972, I think. So it has been almost 50 years. And the damage from this very misguided study is still affecting people's utilization of public health services. So that's it for me. Thank you very much for listening, and it was kind of fun pulling this together.
Thank you for wonderful, wonderful talk. I think there's a lot to learn here about how anthropology has grown and changed, how the world has grown and changed. Hi, Martha, I see the hand. What I'd like to do, unless there's a burning thing to bring up now, is hold all the questions for later. But if people want to put them in the chat, we'll have them available, and everybody will remember them for later. Martha, did you want to say something?
Oh, no, that was just a clap.
Oh, okay.
That wasn't a raised hand.
That
Thank you,
wasn't a raised
Martha.
hand. Yes, no, this was great. And I think there's something to think about here, because I think, Tuskegee, this whole mythology that sort of stays for generations,
Yep.
is something we need to pay attention to. So on that note, we'll hold all of this for later, any questions or comments. And I want to turn to Isaac. And I have known Isaac since he was, I think you had just finished up as a undergraduate, and we're in the first year of your graduate school. He was one of the researchers on the Faith and Organizations Project, which was a very busy multi-methods project, but mostly ethnography at that stage. And Isaac was so wonderful on this that he rapidly became my analysis director. And he was the one who really understood how, we had several qualitative analysis tools we were using, but he's the one who really understood how to organize and help a group of close to 20 of us from across the country, analyze things together as a group and put it into reports. So we had much to thank Isaac for. And he has gone on now. He's now an applied anthropologist working as a contracted monitoring and evaluation specialist for the U.S. Department of State and USAID. Over the past decade, he's conducted evaluations of more than a dozen international development and assistance projects around the world, including natural resources management projects in Kenya and Guatemala, disaster response programs in Nepal and Bangladesh, economic growth initiatives in Ghana, El Salvador, and the Philippines, and U.S. security assistance agreements in Chad and Uganda. He holds an anthropology MA with an international development focus from George Washington University and a cultural anthropology BA with a Middle East focus from University of Maryland, College Park. Isaac, you are on.
Just to double check, can you confirm that you can see my screen? I'm sharing slides.
Yep, it looks great.
Great. Okay. So as noted, I'm Isaac Morrison. I'm a monitoring and evaluation specialist. I work in the international development and assistance sector primarily, contracting for USAID and State Department for the last 10 years. Before that, I was doing some work in the nonprofit sector, doing similar things. I also have a small side project that's just getting started called Qualitative, that's social science data collection resources. If there's time, I'll mention that at the end. But really, the thing I want to talk about today is this overlap between anthropology skills and technology tools in the evaluation sector. I think this will probably dovetail really neatly with what Mary has outlined, but just in terms of roughly speaking, what does anthropology bring to the table for the field of evaluation? It's human-centered, it's holistic, it gives equal or greater time to qualitative data as well as quantitative data. It accepts nuance and ambiguity and subjectivity. It's attentive to both your emic and etic perspectives. It places a high value on participant observation and thick description. So with all of that in mind, and that's far from comprehensive, but what technology tools can facilitate or empower anthropology's distinct offerings in this area? And I'm probably going to run through a few things that a lot of people know, but what I've done is I've tried to cue into just three really rough categories with applications that I've worked with personally, which is qualitative tools, contextual tools, and collaborative tools. Like I said, some of you already know some of this, some of you probably know all of this, but I want to start just by a quick word about qualitative data analysis, particularly CAQDA, as it used to be called, computer-assisted qualitative data analysis, now just called QDA analysis or QDA software. When I was first moving into the international development sector, it was a real challenge. I was an anthropology student, yes, I had my master's degree, I had some experience doing surveys and interviews, but I didn't have what I think they're really looking for, which is that either Peace Corps or extensive experience overseas that a lot of people doing their PhDs might have, but I had just an MA. I didn't speak another language fluently. I speak bits of several and none of them well. And I had managed to do a series of interviews for an evaluation for a firm in DC. I talked to some people in DC. I did some phone interviews. And when it was done, they were apparently relatively happy because they called me back and they said, hey, you've got this thing on your resume. It said you do qualitative data analysis. We've got this other project. It's a mixed methods project. Per Mary's point, we've got this framework. We've got all this survey data, all this quantitative survey data. And then we did these focus groups in Western Pakistan. We did 16 focus groups, about 3 hours long apiece. We've got 400 pages of data and we need somebody to analyze it and we don't know how to do it. And I was like, oh yeah, I'll do that. And that was, fortunately I had worked with Joanne. Working with Joanne, I had actually gotten my initial exposure to some basic qualitative data analysis software. And I, having done the anthropology degrees, I understood the process of qualitative data analysis. And so I was able to get in the door and do this analysis in a way that they were happy with. They gave me more work. They hired me. I was there for 7 years. It was great. And I went from there to more work, all sorts of everything I had hoped I would be able to do. And the real window was being able to use qualitative data analysis software. I've highlighted 4 particular platforms: NVivo, MaxQDA, Atlas TI, and Deduce. Those are probably the most commonly available or most well-known platforms. 10 years ago, there were probably noticeable differences between them, but they have conducted this sort of act of convergent evolution where they all sort of borrowed from each other enough that having worked first on MaxQDA for a couple of years, and then moving over to NVivo, I picked it up very quickly. I messed around with Atlas TI and Deduce. If you have learned one the learning curve for any of the others is negligible. But the thing is, and excuse the quality of this photograph, this is from 2008, probably around the time when I first met Joanne, first year of grad school. This is how I was doing qualitative data analysis then. And it was, I think a lot of you have been there. Scissors, tape, highlighters, if you were lucky, color-coded Post-it notes.
Yeah.
If you went to bed and you got up the next morning and half the Post-it notes had fallen off of the wall, you were in trouble. But if you had them on the floor, your cat or your dog might have walked over them. It was great, and it's exciting, and it works, and it's a viable system. But at the same time, once you move past maybe a dozen or so sources, you really start to get very overwhelmed. And what I learned very quickly in working with, in this case, Max QDA, is the quantities of data you can work with become, by orders of magnitude greater, and you can switch between them. You can code very quickly. You can switch your codes. There are so many ways in which you can adapt very quickly and work with very large data sets. You can export to Excel. You can export to Word, and the ability to move all of this data around is it's so tremendous, and it's so helpful that it's what allowed me to get a seat at the table as a technical specialist in a field where there were people who had much more overseas experience than I did. So first of all, that's the number one thing. In terms of contextual tools, I also want to touch on social network analysis, which has been a buzzword for more than a decade now. But Node Excel is the platform that I've used the most. It's just a plugin for Excel. There are other, I think R has actually a very similar capability, but just to invoke a past project, because so much of understanding human activity and human interactions is about these relationships, whether they're human relationships, organizational or institutional relationships. We were doing a project evaluation for this collaboration between USAID and NASA, where they were giving satellite maps for disaster response. This was before the big earthquake. There'd be an earthquake or a landslide, a flood, and they would get these disaster maps to the Ministry of Home Affairs National Emergency Operations Center. Here's these maps of the location, and they get them to them within like 24 hours, like fantastic. And the question is this doing any good? Are the maps getting the people they need to get to? Are they helpful? And so we went into this with this question, and one of the things we wanted to understand is the landscape of the disaster response sector. And so we talked to people across the disaster response sector, and we used a survey that was sort of optimized for Node Excel so that we could do a network map. And the first thing we learned is if you look in the very center of this, there's this big red dot. It says MOHA NEOC. That's the Ministry of Home Affairs National Emergency Operations Center. They were getting the maps, and it was their job to share them. But if you look above that, there's the big black dot, which is Red Cross, Nepal Red Cross. And it became immediately evident as soon as we started putting these numbers and the survey results into into Node Excel, that they were better connected than everybody else at all levels, national, district level, local level, and they weren't getting these maps. And so we were able to come back, show them the maps. So it didn't just help us in our analysis, it helped us in our communication. You need to build a relationship with the Red Cross if you want these to have any value. Also, in terms of relationships, I think it's critical to understand geographic relationships. And I think similar to some of Mary's points about how you don't have to be a statistician. There are people whose jobs it is to be statisticians. You don't have to be a GIS expert. You don't have to, the two main platforms, ArcGIS, which is the brand name, and QGIS, which is the free version, and they do the same stuff. You don't have to be a GIS expert, but you need to understand the capabilities of these platforms so that you can communicate them. You can communicate what you're trying to do with the person who wants to help you, both for analysis and also for communication. I also put the names of two other platforms, OpenStreetMap and Ushahidi, which are much more like ground up platforms, but also very accessible. Ushahidi in particular has been used for anti-corruption, for election monitoring, and you can actually have people submit information directly to the platform. They can text message, they can call, they can email, they can go to the website, they can send WhatsApp messages if there's an incident, and it automatically charts it on a map. And I mean, when this was come up with, almost a decade ago, it was great. But now in this time where we have limited travel mobility to some of these places where it's costly, being able to get that level of ground level information, if you can, is just, it's so helpful. The other thing I also want to mention as far as understanding relationships is communicating relationships from a contextual perspective. Tableau is probably the hottest topic right now in terms of really like high-end evaluation work. And the thing about it is that it works across so many different data platforms. You can integrate tables from Excel, from R, from SPSS, SAS, but it also fully integrates with GIS programs. So you can have mapping data, you can export your qualitative data into Excel tables and integrate that as well. And it's this just really useful way of merging information in a way that is truly like interdisciplinary, again, where you can communicate things to audiences that are oftentimes very skeptical of qualitative driven recommendations. They want numbers, and if they can't get numbers, they want maps or they want graphs. And Tableau, it's insane how powerful it is. I've only scratched the surface. It's honestly probably not the best platform to learn by yourself if you can take a class in it, but the level of integration between data sources is tremendous, and the demand for it is very, very high. And I watched people who knew what they were doing with it. I was just doing little bits of updating and inserting pieces of data. It's incredibly powerful for data visualization and for analysis and for producing finished products. Highly recommend it. But lest we get too hung up on the idea of technology, I also want to emphasize that this is a chart that I built in Microsoft PowerPoint. It's just an information flow for messaging around flood early warning systems in Bangladesh. And if you know how to use a platform well, that's probably the best platform to use. I think using a powerful platform poorly is always going to be the worst option than using a platform well, even if it's not perfect for what you're trying to do. And this, if you play around with PowerPoint, you can do a whole lot with it in terms of just putting information into an integrated system. So, I'm talking about these technology tools, but that doesn't mean that older platforms, Microsoft Word, Microsoft Office, is obsolete. It's critical, and it gains more utility as we go on because they're always pulling from other places. The last thing I'll mention is the idea of collaborative tools, and this is another one that I've gotten to use, particularly in the last 2 years with limited in-person interactions. Miro, there's also a similar site called Figma. Both of these are great for whiteboarding. When you have a group of people, some of you may have experience working in like Google Documents where you can have several people writing and editing at the same time. If you're on a conference call, which can be annoying and confusing, but sometimes it can be productive. That said, the Miro program, it's essentially like standing in front of a whiteboard with Post-it notes and dry erase markers. It's relatively intuitive to use in a very effective fashion. It actually has a whole other layer of additional like mind map tools and network analysis tools that, again, I haven't even scratched the surface on, but just the basic utility is so handy for collaboration when we're working remotely so often. And then also just, I think, let's be honest, air travel is not optimal. I mean, for the sake of the planet and for the sake of pollution and just good practice, if it's not necessary, of course we want to see everybody in person. But this provides such a great opportunity to do so much of the collaborative work just on a conference call. Get everybody, on this platform and on the same call, and you can move things around, and people can really sort through things, as I said, in a very intuitive fashion. On that note, I'm I'll throw up my website, uxeta.com. You can follow the social media things, Uxeta1 on Twitter, and there's Instagram, all of these things. But I just mostly want to say thank you to Joanne. If people have questions, I play with a lot of different software platforms because they're useful, but also because that's how I've been able to get in the door to situations where, you know, people with a lot more experience than me were doing very interesting things, and I got to be a part of it. And I got to be a part of it as a, you know, as an equal partner. And, you know, I thank you to Joanne for bringing me in that fashion, you know, more than a decade ago, but it's still working. And I'm happy to talk about any of this after the other sessions during the Q&A. Thank you. And on that note, I'll stop sharing.
All right, thank you, Isaac. That was terrific. Isaac, you've actually got a minute left. So let me ask one other question. Can you bring this full circle and just talk for a second about how you integrate all this wonderful technology with good old-fashioned ethnographic holistic approaches?
So, great question. I stole this from Jan Chipchase, Field Study Handbook. And there's this sort of sequence he talks about is the evolution of understanding, and moving from hypothesis to collecting the data to turning that into information to knowledge. It looks different at every step of this process, but I think the understanding that there is so much we don't know, and being able to embrace ambiguity and subjectivity has always, I think, given me a much more comfortable proficiency in these areas where people don't like things being fuzzy. People don't like things being messy. They want clear answers. And oftentimes, if you look for clear answers, you miss the substance. You want a yes or no, you want a number. And I think anthropology has really driven me to just embrace the fuzziness, the squishiness, who used the term the mushy middle, and not just convince people that my findings are correct, but persuade people that they shouldn't expect definitive answers. What they should expect shouldn't be. I mean, yes, occasionally you'll get good, clear studies for, you know, some health programs or things like that, but ultimately, like, you got to wrestle with these things, and I'm not going to hand you a yes or no answer, and if you come up with a yes or no answer, you know, I want the client, whoever I'm providing this to be able to demonstrate that they understand, even if they have a yes or no answer, it's never a full yes or no. They always have to make room for the missing parts that aren't fully captured in the limited things that they've been given. Maybe that's the best I can do with that.
That's great. Thank you. That's terrific. All right. So we have spanned some time in Anthro, and we've moved into international affairs, and that's a great segue over to Jerry Britton, who is going to talk about the place of anthropologists in international development evaluation. So Jerry has more than 35 years experience planning, managing, and evaluating international development programs, with particular emphasis on development effectiveness, development learning, and development management. He's a two-time recipient of Vice President Gore's Hammer Award for Reinventing Government. He was in on Reinventing Government from the start. He's authored 4 books, dozens of articles, and scores of professional papers in the field of anthropology, international development, program evaluation, and public management. He served as director of USAID's Center for Development Information and Evaluation. That's the agency's Central Evaluation and Knowledge Management Office from 1996 to 2002, and is director of their Office of Management Policy, Performance, and Administration from 2002 to 2008. After retiring, he served as Senior Regional Performance Management and Evaluation Advisor for the Philippines, for USAID for the Philippines, Pacific Islands, and Mongolia from 2011 to 2015, developing country strategies, performance management plans, and evaluation designs. Since 2015, he has worked as a management and evaluation consultant for a variety of US, UN, and international agencies and private firms. He received his degrees in economic anthropology and human ecology from Columbia University. Before joining USAID, he served as a professor of anthropology at Northwestern University and associate dean of graduate studies and research at Southern Illinois University. So we are very honored to have you here, and I'll let you turn the floor over to you.
Thank you, Joanne. You never know who your audience is going to be when you put together a little talk, and this is a really impressive audience. As Joanne said, probably half the people easily could be up on the panel. Even more frightening, several of the people are like kind of my evaluation heroes, people like David Fetterman and Neil Tashima and Mary Clark, who've just done really innovative evaluation work in all over the world. Let me see if I can get my screens up, and then I'm going to do an aside. If I do share screen, Microsoft, this is it. Does that go up? Yes. And does this make it move? No, I don't know how I make it move. Does this make it move? No.
You click on, you click
I
on
see,
your
this makes it move. Okay, I'll go back. Great. Let me do an aside like other people have done, because I also ended up not planning to be an evaluation research person, although I was always interested in social change, directed social change, and applied anthropology. I too did my PhD in anthropology in the mid-1970s, studying social and economic change in a little Newfoundland fishing and farming community, looking at economic decision-making. And one of the things I was really interested in was all the social welfare and economic development programs that affected my little island community. So I started looking at those and how programs worked and organizational behavior and bureaucracy. And when I started teaching at Northwestern, I started writing about things like that, organizational behavior and bureaucracy. And I got sort of lucky because two of the founders of modern evaluation research, Don Campbell and Tom Cook, were running a postdoctoral seminar in evaluation research, and I started sitting in. They were the founders of experimental evaluation, and I'm an anthropologist. But Don Campbell also was the one who wrote about the importance of qualitative knowing. So they were sort of excited to have an anthropologist around. And all quantitative knowing, as Campbell said, is based on qualitative distinctions. And I learned a lot about experimental methods and how to do experimental designs, and started doing a lot of evaluation consulting. And around 1980, I took a leave of absence from Northwestern and helped to set up an evaluation program in the U.S. Department of Agriculture, the Science and Education Administration. And I was all excited about that. They offered me a job. I decided to stay. Somewhere in the process, Ronald Reagan had gotten elected, and he put a freeze on government hiring. So I went back to academia and dean for a couple of years. But then in the mid-80s, came back to be an evaluation specialist at USAID and stayed there for 25 years. And it's been fun. It's been a lot of fun. And I've seen a lot of anthropologists doing evaluation. So let me talk a little bit about evaluation and how anthropologists are engaged, kind of building on what other people have said. Let me go back to start where our first speaker started, talking about what is evaluation again. According to Mike Scriven, one of the best known evaluation scholars, evaluation determines the merit, worth, or value of things. It's about identifying relevant values and standards through empirical investigations, performing empirical investigation techniques from social scientists, and integrating conclusions that encompass both values and data. But that's just a fancy way of saying evaluation represents a credible, defensible, convincing set of procedures for making judgments based upon empirical evidence. Something anthropologists actually aren't really comfortable doing often, so it's interesting to see anthropologists in evaluation. It's an alternative to profit and loss tests to make judgments about value when markets are absent. It's a way of answering so what questions about the differences a program or project makes, in what ways and for whom. And most importantly, it's a structured empirical analysis undertaken to answer specific questions about what works and why. Most importantly, evaluations make judgments, and lots of different kinds of judgments. It could be something simple about the quantity or quality of goods or services that a program delivers. I have a program that's supposed to deliver vaccines to people. Are they actually there? Do people get them? About differences between expected and actual program and project results. We planned this to happen, but that happened. We planned to reach 20,000 farmers with agricultural extension programs, but nobody came to our sessions. We didn't reach anybody. So we changed the program probably and made do. It's about how programs are perceived or experienced by participants. It's about the impact of programs or projects on people or institutions. It's about the efficiency and effectiveness of program and project alternatives. It's about how programs and projects can be improved, or in a social science or a scientific sense, it's about the validity of underlying development hypotheses. If we do this, that will happen. That's a hypothesis. And evaluation to check whether that's true. At least that's one of the things they can do. Why do we evaluate development programs? One of the main reasons is because we have to. The rules require it. An awful lot of evaluations are done simply because you have to do it. And in fact, when I first came to USAID, you had to do a midterm evaluation. You had to do an annual evaluation of every project back in the early 80s. And people just did them, and most of them were terrible, but you had to do it. And people still often do evaluations because they have to do it. Sometimes you do it because we want to make sure we're doing what we're saying. It's about accountability. To answer questions about unexpected monitoring data. Different results are occurring than we expected, or different outcomes are occurring than we expected, or different changes are occurring than we expected. We want to know why. Sometimes we want to understand how programs are being implemented. Sometimes we want to address issues such as relevance, cost effectiveness, sustainability, customer feedback, unintended results. Often we want to make recommendations about program improvement. And we want to test the validity of underlying hypotheses in order to draw broader lessons for programs or policies. 3 basic evaluation models, 3 different approaches to evaluation. And it's important to distinguish them. Audit, accountability, and an anthropologist can be involved in all 3, although they have different roles to play. Audit, accountability evaluation, contextual process evaluation, often formative evaluations, experimental or impact evaluation. And those different evaluation models answer different questions, involve different data, and have different underlying epistemologies. Audit accountability evaluation, a lot of what we do in evaluation, is really asking questions about, did the program or project do what it said? Important to know. Very hard to see if it had the impact that it was expected to have if it didn't do what it said it was going to do. Did it spend what it planned? There are certainly lots of people who want to know whether budgets are being spent appropriately. Did it deliver what it promised? Did it achieve what it expected? And did it play by the rules? Was it consistent with policy and procedure? Audit and accountability evaluations are often about reporting to OMB and Congress, so required by them. They often are related to or the starting point for audits. They can unearth important issues. If a program didn't do what it said, that's important to know when you're trying to see what difference it made. It's important to know what it actually did. But they provide less opportunity for program learning. Contextual process formative evaluations tend to look more at how the program or project was implemented. How inputs, dollars, technical assistance, commodities, were transformed into outputs to achieve results. How various participants to that process perceived or experienced the project and its effects. And again, how, particularly from the perspective of those participants, the program or project could be improved. And one of the interesting things that anthropologists have added to many evaluations is how different programs or projects look from the perspective of different people, different participants. There's definitely a Rashomon effect here. Contextual process evaluation is usually descriptive and case specific. It's often and always should be based on good empirical data. It seeks in-depth understanding, typically, of how results are achieved and their significance to participants. It can provide a sound basis for action about that program or project, but it's often difficult to generalize beyond the case. Third model, experimental or impact evaluation. Can results be attributed to the program or project intervention? Is the development hypothesis valid? Is the development hypothesis generalizable, i.e. will the program work elsewhere? How big is the result that we can attribute to the program? And more basically, are we doing the right thing versus performance evaluation? Are we doing things right? Are we doing the things we said? Whatever we're doing, is it making a difference? Experimental or impact evaluations don't necessarily examine how the program works. Conclusions are often reached through indirect inference by comparing situations that differ only in the fact of treatment. I mean, the model is, a vaccination program. A control group doesn't get the vaccination, experimental group does. Is there a difference in outcomes in terms of disease? We hear about them all the time with COVID. Randomized controlled trials are the gold standard because other designs increase the risk of incorrect inference, although one can account for that. There are all sorts of quasi-experimental designs, and which I'm not going to go into. More generally, though, experimental or impact evaluations work best when the treatment is fairly narrow and it's fairly specific, when theories of why the treatment will work are well defined. Again, the medical model, we have a vaccine that's supposed to create antibodies to stop the disease, so we understand the theory. And where implementation is fairly straightforward. Either people are given the shot or they're not. Works really well in those kinds of circumstances. It works fairly well in other kinds of circumstances too. One of the most significant developments in evaluation in international development over the last 10 or 15 years has been the call for more experimental evaluation designs so that we can reach unambiguous conclusions about whether results can be attributed to a program or project, so that we can test development hypotheses and provide a basis for future action by making comparisons, by having a counterfactual. And indeed, Banerjee, Duflo, and Kremer won the 2019 Nobel Prize in Economics precisely for demonstrating the value of experimental evaluations for alleviating global poverty. Certainly the potential of this has been recognized. But, according to Vinod Thomas, former World Bank and ADB Evaluation Director General, such evaluations also have limitations. Impact evaluations can't answer many important questions about whether programs are well valued, effectively implemented, or have unintended results. They're designed to tell you whether the program achieves the results it was intended to do based on its underlying theory. Also, many programs are unsuitable for impact evaluation because results are targeted at institutions. It's hard to count in the way you can when treatments are based on targeted individuals, because treatments are multidimensional. So it's hard to tell what worked and what didn't of the treatment, even if there's a difference that you can observe in the comparison, or because theories are well defined. And sometimes experimental evaluations, experimental comparisons, particularly when they withhold treatment, can be unethical. If we know something's going to improve the economic well-being of a group of people, and we want to, if we're pretty sure, and can we really withhold it? If we're you have that issue with vaccines all the time. When is it that you call the effect and just give the vaccine to everyone and stop having people who are control groups? Quality impact evaluations are those that ask relative questions, use appropriate methods, apply methods regularly to deliver relevant conclusions. So the gold standard really in trying to understand impact is appropriateness. And in many cases, impact evaluations aren't particularly relevant. They're a narrow and limited subset of relevant evaluations. Let's skip this one. All evaluations, whether they're process evaluations, contextual evaluations, formative evaluations, whether they're looking at implementation, whether they're case specific, whether they're experimental designs, even if they're audit and accountability evaluations, need to be built on solid empirical data and relevant comparisons. So many anthropologists are involved in international development evaluation. I would guess at least half the people in the audience of this session have been involved in evaluation research. But very few anthropologists are hired because they're anthropologists. Every once in a while that happens, but it's rare, the exception rather than the rule. Often anthropologists are hired, in international development at least, because of their local knowledge, because they've worked in West Africa, or they speak the language, or they know this particular target population. And other social scientists can have those kinds of knowledge and experiences, but anthropologists are much more likely to. Sometimes they're hired for their data collection and analysis skills and evaluation experience. Evaluation projects like to have people who have done evaluations before. Usually, I'd say anthropologists are hired because of their ability to collect and analyze qualitative data on how programs are implemented and how programs are experienced and understood. and how they affect participants. And I found those little color-coded stick-ons that our other speaker was talking about really, pretty advanced. When I first started doing content analysis of my field notes and of my data sources, I used knitting needles and hole punches and shook them through the notes that were on cardboard things to see which ones fell through for that code. It's a lot easier now to do qualitative analysis. And anthropologists particularly are useful if they also experience collecting, analyzing, and interpreting quantitative data in context. So knowledge of statistical analysis packages, knowledge of statistics, the ability to understand what quantitative social scientists do, and particularly the facility with qualitative analysis software, as our other speakers indicated, are all very useful. There are issues for anthropologists, though. A lot of anthropologists, particularly academic anthropologists, are very uncomfortable working for donors. If you're a hired gun for the World Bank or for USAID, or even for an NGO, that can be uncomfortable. What's your role? Aren't we supposed to be responsible to the people we study? In this case, usually the participants in the program or the beneficiaries. At the very least, I think it's essential that we take a position of doing no harm. And sometimes you can get into ethical dilemmas when you're working for a donor who have different points of view on the effects of programs and what the costs can be that are associated with them. Clearly, being involved in evaluation research has value for anthropologists as well, employment and experience. Certainly, throughout my career, it gave me the opportunity to go all over the world and study all sorts of interesting people in all sorts of interesting situations. When I started and had to apply for grants, which dried up, it was a lot harder. So that's great. That's great. It also gives you an opportunity to represent and empower participants. I mean, as I said, anthropologists are usually involved because of their ability to get information from participants, to get unique points of view, to get, let's put it in anthropological jargon, but to get the perspective of both intended and unintended participants. Being involved in evaluation gives us an opportunity to test theory in practice, something that anthropologists working in academia or in other realms may have more problem doing. But probably, and most important to me in my career in being involved in evaluation research and international development, it's an opportunity to make a difference. For development, you could say, but really for the people who benefit from development. Final thoughts. Evaluation is essential in international development to understand what we're doing, to learn from experience, and to convince others of the value of what we're doing. Different kinds of social scientists work together with program managers and implementers to make evaluation useful. It's amazing. I think program managers have gotten better trained over the years. At times they can be very dense, but we all have to work together. And with economists and psychologists and people who look at other kinds of data. Anthropologists have a critical role to play, particularly in understanding how programs are experienced by and affect program participants, and in empowering those participants to influence the programs that affect them. Evaluation, from my point of view at least, is a critically important arena of anthropological practice for testing theory and application and for making a real difference for the people development affects. And on that note, I'll have to try to figure out how to get out of my screen, stop screen share.
All right.
And I'm done.
Thank you so much. That was great. Okay, so for our last speaker, we are going to go back to public health. And we have all been talking about multi-methods and interdisciplinary, and I've always been fond of transdisciplinary projects. And so our last speaker is Elena Lumby, who is actually a doctor of public health. So she brings 10 years of experience working in public health as a mixed method researcher, facilitator, and professor. She's a senior research associate at LTG Associates, which I think is a group we all know well. A consultant for, well, I'm not going to read that. Her qualitative work includes stakeholder and cognitive interviewing, facilitating meetings and focus groups, case studies, usability testing of web platforms, and health education materials testing. Her recent quantitative work includes survey development and analysis on the organizational impact of the Child Abuse Prevention Initiative in family serving organizations, in addition to analysis of federal and state level health data. Dr. Lumby also serves as adjunct faculty at the Milken Institute School of Public Health at GWU and teaches graduate level courses on practical data analysis, health promotion, program planning, community diagnosis, and structural drivers of health disparities. She received her MPH in community-oriented primary care and doctor in public health and health behavior from GW. And she's going to be talking to us about intersections of public health and anthropology in evaluations. So, Elena, take it away.
All right.
There she is.
And can you see my slide okay?
Yep, everything's great.
Everything's great. Awesome. All right. So bringing it all back around, I'm here to speak as somewhat of an outsider, although I've been accepted as a guest, which I appreciate, as a kind of a public health, straight line public health researcher that has been enjoying the world of anthropology. So my background was covered in my lovely bio there. But the overall gist is I've been trained in pretty strict public health methods, which uses a public health and somewhat of a biomedical lens. And what I try to like to contribute to today's conversation and idea is to give you a sense of how us strict public health folks, not medical anthropologists, are trained so you can see where our shortcomings are, where we can work in synergy with one another, and of course, where public health could gain a lot from working with anthropologists. Because I think understanding the frame that someone is working from is critical in being able to communicate with those folks. So I want to begin, because it's relevant, with the story of our people, because we know origin stories are very important. And we like to, and in public health, as public health students, and when you're in your program, and when you're going to various conferences and whatnot, John Snow is still kind of hailed as the father of modern epidemiology, although obviously it's been done for a long time by lots of other people. Still, bear with me. This is our origin story. So if you're not familiar with Mr. Snow, he identified the source of a cholera epidemic that was occurring in London. And he did this by applying a bit of a scientific method in that he mapped out where the cases of cholera were occurring and compared these cases to other areas in London. And what he did was identified a certain pump, the Broad Street pump, that was contaminated with refuse from a cholera-infected child. So he then labeled, in order to address the epidemic, to remove the handle of that contaminated pump and thus ceased the epidemic. So this is a lovely story. It's a bit more complicated than that. However, it gets to a fundamental truth or perspective of public health that remains today, and it continues to be a bit of our Achilles heel that I think anthropology is the greatest balm for, which is we're focused on a single contaminant, so the cholera. And then we get very fixated on a single intervention that's gonna fix it. So the silver bullet idea. And this is embedded in all of our training. And it hasn't been very well updated in my perspective. And from John Snow's work and the early epidemiological and public health work that was done, the use of the epidemiologic triangle was established. So there's, three little parts to it. Environ, I know how to spell environment, but if you've worked with PowerPoint, it does not like adjusting font sizes. So there's the environment in which the disease occurs, the agent, or what is producing the disease, and then the host, which is a lovely way of saying the person. So the environment in the case of the pump handle, Broad Street case was that environment of the street the folks were on, the poverty that they were living in, et cetera. The agent was what caused the disease, which was cholera, and then the host was the individual who then became infected, so the folks of Broad Street. Now, it's important to note that prior to John Snow work, what was believed to be going on amongst folks, doctors, and commoners alike was that it was in the air. It was the miasma. It was dirty air. And that meant that folks more accepted the disease instead of taking an active stance to address it. So this epidemiologic triangle is core to our training. And it's done great work. It got us to a lot of awesome places. So milk pasteurization mandates saved millions of lives. Polio eradication. We fortunately don't have iron lungs as much anymore, and so many people are living longer and healthy lives, as well as smallpox eradication. Now, it was because of this promise of being able to help many people, or I like to say, with a doctor of public health, it means that I can doctor groups of 3 or more, not individuals. I was very compelled by this idea of getting to help lots of individuals. However, I was also compelled by the role of environment, so structural determinants of health, poverty, power, politics, et cetera. How is that driving ill health and disease across the world? So that led me to pursuing both a master's and then a doctorate in public health, because I couldn't get enough. But actually, why I pursued the doctorate in public health was I wanted to learn more of the toolbox. Some folks spoke about quantitative data. I was terrible in math forever, and I made it a personal mission that I am going to get very good at biostatistics. So I determined that a PhD was the best way to do that. However, I became very concerned because my bookshelf started getting overloaded with lots of books that had nothing as much to do with each other. I was very excited about methods. I was in HIV work. I was in tobacco control work. I was all over the map. And I also found that I get bored very quickly. And while in the world of academia, thinking I might want to go in academia, this was very concerning because you should become a subject matter expert. You should know everything there is to know about HIV inside and out. And I saw the very opposite happening. And thus I began to have a bit of identity crisis and a huge fear that maybe I would be unemployable, which then brought me on my journey to evaluation. And I'm trying to put some pretty pictures on you. I know I'm the last speaker, so maybe this will help you. Look at the screen. So I started opening myself to happenstance, and I was trained in qualitative methods, and I was like, I'm going to do a thematic analysis of the stuff that I like and what I do. So at GW, I did evaluation of policy impact of funding for syringe exchange programs. I did a really cool mixed method study on the implementation of Cigarettes and Other Tobacco Products Act in India. When I was at American Institutes for Research, I worked on a whole bunch of evaluation of programs related to the implementation of the Affordable Care Act. We got to talk to providers. We got to talk to patients. We got to work on surveys. It was really exciting work. And then I was also engaged in lots of knick-knack projects of testing quality websites, working on survey topics, et cetera. And the theme that I noticed was before it seemed like there was no path ahead. Elena's scatterbrained and I like everything. I'm interested in everything. And I felt overwhelmed and crushed. But then when I realized in my little thematic analysis that evaluation was the key word and a profession that no one had told me existed, suddenly a path was clear and I was quite thrilled. So I said, okay, I'm going to become an evaluator. How do I do this? This is the field I want to do. It means I get to be a Swiss Army knife. I get to be being a master at being a Jill of all trades, I like to say. So what did I do? So I actively sought out evaluation opportunities at the different organizations where I worked. I looked for mentorship by senior evaluators, asked lots of questions, and were more than happy to help. I think a critical thing was participating in proposal writing. So I could write prior capes, what we have done, et cetera, But that meant I got exposure to the thought process of those senior evaluators and how they are picking apart a problem and proposing that we address it. And I think that's where I really learned the inner workings of broader program evaluation, how to apply those methods I learned in my doctoral program in more of a disparate fashion. And then applied my research skills wherever I could, and also did a lot of independent study. I'm very good at school, and I'm not so fun enjoying not being in school, even though I teach. So seeking out those independent learning opportunities is critical. A lot of it, as Isaac said, was in vivo, teaching myself a lot of in vivo. Yep. However, in everything I was learning and the folks who I was working with, who were mostly doctors in public health and very strict public health analysts, something was missing. This little disease, lovely epidemiologic pyramid that I'd been trained in, as long as all the educational and psychological models around it and what drives the host, it kind of felt unstable and like things were falling apart. I was also getting very bored. And so some things I started realizing, coming to my own realizations, is that public health really is grounded in this biomedical approach. And when I was working on these really large-scale evaluations, I just didn't love the results that we were getting because I didn't feel like they were as rich or, as someone else said, thick as they could be. And therefore, I felt like we did not understand really why the programs did or didn't work. We knew if they didn't work, but didn't understand this why. And as wonderful practicing anthropologists, you can see issues around how culture and context affect every aspect of the epidemiologic pyramid is important. And if we want to go even further, the understanding of disease itself is, sorry, pictures are in the way here. Understanding of disease itself by the host is impacted by all of the factors in the pyramid. And I think public health being a little narrow-minded and not being well integrated with anthropology as we should be has been evident in the COVID pandemic. As we know, public health has some wonderful, think of that pyramid, opportunities to solve the crisis, which is masks and a vaccine. Pretty simple, right? However, in the anti-mask, anti-vax protests, I think we have seen something very different emerge, which public health, I will say, does not have very, very good tools for. You'll note that CDC, God bless their hearts, et cetera, a lot of their campaigns are addressing, so this one I see is about norms, letting people know that lots of other people have been vaccinated, so it's safe for you to do, or it's normal. Things about whether the vaccine has side effects or not. It's been lots of knowledge-based materials, and in public health, we often pull the knowledge lever as the thing to create change. However, as anthropologists, and even just taking a look at this picture, I'm sure you're aware that there is a lot more going on and a lot more driving what people are thinking and how they are behaving. And knowledge here is not necessarily the answer. So in my previous work and my uncertainty and feeling like we did not have a great understanding within our public health silo of why things were working, what was the missing piece? Well, anthropology, of course. And anthropology affects every piece of that pyramid, the host. So how does the impacted individual population understand the condition of interest? How do the other components of the triangle affect them? How do they affect the other components? All these things are integrated. The environment, what are factors that shape the physical and cultural environment of the host? How do these differ across contexts? Same thing with agent as well as disease. What are the expressions of the disease? Do they differ based on the host or that host culture? How does culture mediate the experience and prevention of disease? Public health doesn't really have the best tools to answer these questions, but they're very important for solving things. And then talking about happenstance, the best thing happened, which is I was invited by Kathleen Crane and Neil Tashima to join LTG Associates. So I was so absolutely thrilled to go from a public health silo where I was considered to be the creative one, and then thrown into with two absolutely phenomenal anthropologists, and I'm not just saying that because they're my bosses, to get to be exposed to their methods, their thinking, and their decades of wisdom. So being with them and their methods and anthropology, been able to see how we can facilitate a broader perspective in public health, and antidotes were requested. So I will provide one, which was an evaluation that we all worked on that was intended to reduce child abuse and maltreatment. And it was, the intervention itself was very much focused on knowledge, if that sounds familiar, on training staff at family serving organizations in these approaches on reducing child abuse and maltreatment, so prevention. So the funder hired a team of senior anthropologists and me to conduct a multi-level mixed methods evaluation of if and how change occurred at participating organizations where the staff were trained on this approach. Now, LTG, one of the early successes in the program, was shifting the perspective of the funders, who were very public health grounded, and implementers, who were very much training oriented, from this formula of staff plus training equals change. And instead, they really worked with them closely to show that there's a need for shifting culture at these family service organizations to one of family strengthening versus how they did things previously. So in order to do this, we worked with the funders and everyone, and in our evaluation, to show that FS stands for family strengthening. A family strengthening aligned service system would lead to the organization, the leadership's committed to doing these new approaches to preventing child abuse and maltreatment. Then supervisors would be committed, and then frontline staff would be prepared and committed. Now, an issue with the intervention was the preparation was the locus of concern of the intervention, which focused mostly on knowledge or changing how people approached their jobs. And what we did was through two different multiple methods, we created a survey that was keyed to each level of organization. So leadership, supervisors, staff, because we wanted to look at culture, which went across all of the levels of the organization. Your leader can talk a big game about wanting to adopt these models, but if staff are not even aware that this is happening, it's hard to get change. So we created these three different surveys. Each survey was linked to one another. So the answers from and questions oriented towards leadership would also inform, match, and key to those for supervisors and staff. Kathleen and Neil did a lot of direct participant observation, so participating in their conferences, their calls, their meetings, and getting a sense of how all of these organizations were working and interacting with each other, using those rigorous ethnographic methods, which public health ordinarily, we would just want to look at the data to get immersed in what was really going on. And then we did interviews with folks across the spectrum. We did a pre and we did a post, and we were able to look at change between the two. So this yielded a very nuanced idea for the two sites as to what change was happening, if there were barriers, and if there were facilitators. And really what we had found is because the training was so brief, although well done, if data alone, quantitative data alone, such as incidents of child abuse and maltreatment, or attendance of training or knowledge, if those alone had been presented, then no change would have been seen, and perhaps then a funder would have been disappointed. And instead, we provided this really rich perspective that yielded a ton of insight that quant methodology alone, that public health oriented methodology alone, would not have yielded. I have a little beaver dam here. However, there's challenges to shifting the evaluation paradigm. Public health has a lot of the money for evaluation, and we get in our own way. So here's just a brief example of strict public health getting in its own way. So this is a well-known nameless funder, was interested in whether or not a new program approach was going to create change. So the LTG team, we worked together to put together a very comprehensive framework of what could lead to changes at the organizations and for patients as a result of the intervention. And so we wanted to look at the history of the problem, the local environment, the context, the history of the individuals who were participating and receiving care in the program. And while we had created this wonderful framework that would have yielded very useful and interesting results, we then got pushback from the funder that they were not interested in any of this. They did want a qualitative piece, but pretty limited to what were folks' response to open-ended survey questions and to do some interviews with staff. And this is an funder that holds the purse strings to a lot of money. And, you know, and yet thus, you know, I hope their evaluation will be fruitful, but it was just a really big missed opportunity for them. But hopefully this also points to how you can advocate for yourself, which is when interacting with a big funder or when you're maybe being contracted as part of a proposal team, go ahead and really talk about your value to the project. Say, compare what can be learned with your method versus without your method. What are the gaps? What are you going to add? And that will get funders much more excited because ultimately they want to know if they got a good return on their investment. And it's the nuance of anthropology that can really give them much better sense of what that change was versus perhaps just dollars saved or lives saved. So tips on getting into evaluation. This is a very senior crowd, very intimidating, but I'll pass it along anyway. But this is from me as a public health person. First off, there's no set map. I think you've gotten a sense from the others here that a lot of us kind of wandered our way in here because when you go to school, there's no Become an Evaluator program or posters on the wall. Another thing is if you're going to work with public health folks, orient yourself to the way their evaluation frameworks. So the CDC has a lot of eval frameworks, great place to start. A lot of them are educational for health departments, so they're pretty easy to understand. Take a look at recent public health eval textbooks and take a look at publications on projects that interest you and see what the approaches are. And then fill your toolkit with marketable skills. This is something I tell my students a lot. Subject matter expertise is amazing, but if you can read it in a book, maybe use your tuition dollars or your time to learn a tool that you couldn't otherwise teach yourself. So these involve things like interviewing, focus groups, and especially software moving forward. So thank you, Isaac, for doing that great walkthrough of some of the things that are available. And also joining professional associations. For me, WAPA has been a great opportunity of being exposed to a whole different way of approaching problems, getting my creative juices flowing, and helping me spread the gospel to others. But if you're interested in evaluation, the American Evaluation Association is wonderful, pretty affordable fees, and they have so many opportunities to learn everything from beginner level skills on how to do eval all the way to advanced things. Get exposed to what people are doing in the field and what are the new trends that are emerging. And then own your story. Don't come in feeling like you have less to offer than, say, a quantitative statistician. I know they're intimidating, but their work is boring. Own your story. Be able to say, what are your skills? What do you add to the project? And how is that information you'll gather going to help change and save lives? So that's it for me. Thank you so much. And feel free to email me or anyone else at LTG Associates with any questions.
Thank you so much. That was great. I mean, I think we've sort of gone full circle. I'm going to put this back on gallery view so we can all see, I can see everybody. And we're going to open this up for questions and comments, and we've got lots of great folks here. So, you know, we can do this many, many ways depending on which version of technology you want to deal with. You know, if you want to type things into chat, I think Martha's going to pay attention to that. Or you can just sort of, you know, put your hand up or raise the electronic hand or whatever works. I want to start with a general question for everybody, though. A little bit of my history. I had this wonderful undergraduate interdisciplinary degree that included anthropology. And then my first job was with Westat. Mary, being first on the phones and then a SAS programmer. When Westat was one rented building, so that was a long time ago. Those who know Westat, it's now 6 and a campus. But one of the things, and then I went back to graduate school in anthropology because I was bored with the statistics, right? So one of the things that I think is a challenge, in particularly, I think as Elena brought up with funders, right? But it's also some of our colleagues, is everybody talks multi-methods these days, right? They talk interdisciplinary or transdisciplinary. But when it comes down to it, the real question I have is this a few focus groups for local color or some mapping or whatever, or are you doing, and in fact, a truly transdisciplinary multi-methods in which the statistics and the qual and the fancy mapping and the social network theory and all these things really complement each other to come up with something better and something holistic, which is what, of course, anthropology is at its best has always done. So I'm going to ask everybody on the panel if they could reflect on that for a second, and then I'll give others time to, we've got almost half an hour to comment or add their stories or ask questions. So anybody who wants to talk, who wants to answer that one?
I'll just say, from a transdisciplinary perspective, there is something really comforting about not having to be the subject matter expert. like having somebody that knows, whether it's, having the economist who can explain what a credit spread is and why it matters to the government of Ghana. That's great, because that means that I can sit in the car with him and have him explain it to me. And I can just make sure that we're asking good questions to the people we talk to. And that's been helpful wherever I'm going, is, offload the subject matter material to the economists, to the public health people, to these other groups, and focus on being rigorous and being able to listen, which is, maybe the biggest skill that listen and observe is maybe like the biggest skill that the anthropologist has. Like, they're listening to the content and I get to watch the people, and that to me is one of the most enjoyable things. I'll let them lead the interview so that I can watch the interviewee and come up with the questions I want answers to that are maybe not related to the minutia of the project details.
Great, thank you. Okay, anybody else on the panel?
I think for me, working as a government contractor, the extent of what you could do was always somewhat limited by funding.
Mm-hmm.
So there was always in your mind the dream of the perfect interdisciplinary study. And sometimes CDC funded that, to their credit. But I think that if you don't have your eye on the interdisciplinary study as an evaluator, rather than as an anthropologist, you don't have your eye on that, then you're losing a lot of the value you have to the research agenda of evaluation. And I always was going for the big study, but sometimes you just couldn't afford it. Like, I did a whole bunch of evaluations of public health surveillance systems. I mean, you don't have to go to focus groups with sick people to do those. You just need to talk to public health people, mostly on the phone. So you can do those pretty cheaply. So I guess one size will never fit all, but the ideal is what you're talking about, Joanne. It's the big, balanced, mixed method project. And sometimes you get them, sometimes you don't.
All right.
Yeah, and just two kind of practical suggestions. The first is if you're in a large organization or maybe working across a lot of teams, it can be tempting to have folks just plug and play into a proposal of writing the capabilities. And where, in my experience, interdisciplinary work really happens is when you have the interdisciplinary team starting on the whiteboard from square one. The framework is even developed, and they're working and pushing back and forth to come up with their framework. The second piece about doing mixed methods that I find very helpful, and also for communicating with others, is really creating a table, and Isaac, you've probably done similar things, making a table where you are keying your research questions to how you're going to collect that information, even keying my survey question or our survey questions to our interview questions, and showing the entire flow of how everything is working together, not just here's survey results and then we talk to some people and this is what they said, but it's woven together from the design phase.
Well, in the design phase, very often, if you're a contractor, is in the proposal. And that's where you've got to bring the interdisciplinary team in. Otherwise, you simply won't win.
Yeah.
And so, that's the end of the conversation.
Yeah. Jerry, anything to add?
Yeah, disciplinary distinctions have gotten fuzzy over the years.
Yeah.
And, most sociologists, most social psychologists are really good at running focus groups, or lots of them could do good at qualitative observation or interviewing. So, it's not hard and fast, but anthropologists, I thought Elena's presentation was really good. Anthropologists can are good at asking questions about what the meaning of data is, or what the explanation of data is, or what you need to know in order to be able to interpret a survey. So it helps if anthropologists have a capability, at least, of understanding the statistics, the econometrics, those kinds of things. They don't have to be the experts, but they could often identify the shortcomings and what's needed to make it more useful. So, that gets to be interdisciplinary, I guess, and it gets to be multi-method. But, some evaluations don't need to be multi-method. It depends on the questions you're trying to answer and what you're trying to accomplish. Some are very straightforward. Some are really messy. And the qualitative, understanding implementation, or understanding how people perceive the program, or understanding that family strengthening was really what was key, rather than, some other aspect of the program. Those are really important insights often. And I think that the sponsors of the evaluation value those insights, but, they don't necessarily know they're going to value them in advance. So, there's a real need to communicate, as Elena said, what you're going to add.
Okay.
And that's important. And it usually happens in the proposal stage. It can also happen in the discussions afterwards, or it can happen when you're implementing an evaluation. You have to make changes. But yeah, I think that's where anthropologists often have the biggest role to play, being able to, and maybe it's the holism, but being able to synthesize things, being able to ask important questions. Sometimes knowing they have to turn to somebody else to get the answer because they're not that good at that method, but knowing what they need to answer them.
Great. Thank you. All right. Anybody else on this or any other topic? Yeah, Suzanne.
I'm not sure this is not pertinent only to evaluation, but as far as the question of interdisciplinary, transdisciplinary work goes, that requires a team.
Right.
And putting a team together that's a team, really a team,
right,
is not something that's easily done. And it takes time. And that time of, the storming, norming, forming, whatever, at the beginning, that costs money. So as far as, there should be more transdisciplinary work, and you're sorry that there isn't. It's hard to do. Not just a question of different methods. People think they're talking about the same thing. They talk about focus groups. They may have very different ideas about what that means. So that's just something, it's just an added layer to doing transdisciplinary work.
Yeah.
Can I add, this is Mary Clark. Can I add something with regard to the combining quantitative and qualitative research. I had the good fortune as a graduate student to do some work for Michael Bamberger, who was then very high up in the evaluation efforts in the World Bank. And he's written a number of pieces for the World Bank about multi-method approaches to evaluation. He's not an anthropologist. He's a sociologist, and we have agreed to disagree on certain things, but he's really excellent. And he's also done 2 publications now called Evaluation in the Real World, which is very, very useful because it's taking evaluation methodology, rigorous evaluation methodology, and looking at it as to how can you possibly do this in developing countries, et cetera. So they're both very, very useful resources.
Right. And I think, one thing I learned when I did my first stint in government, I was working with someone who had just come out of GW maybe 3 or 4 years ago, or before that she'd been working there. And we looked at each other and looked at the difference in costs of something that's done with a university where you've got, students which are free or cheap versus something that is done through a professional organization or somebody's putting together a proposal. And I think, when you were saying it's hard to put together those teams, Suzanne, I think now when I look what I'm doing now as a little baby consultant, right? My own little company, just me, is that really I love being a subcontractor, and I now have these wonderful relationships with, some very large organizations, some other organizations which are about the same size or slightly larger than mine that do different things. And whenever a proposal comes up, it's like, okay, we know each other, we know how each other works, and, you do the survey, I do the this, and somebody else does that. And so I'm wondering how, and then there are firms like LTG who, bring in people like Elena, right? So, I'm wondering how much of this is sort of organically coming together in the way that evaluation firms and universities that do evaluation are doing this these days. Anybody?
Hi, everyone. I'd love to talk on that.
Hi, Andrea.
Some people might remember me. I've been a member of WAPA for many years. I lived in DC, 2011 to 2014, and came to Salt Lake City to do my PhD in policy. So I'm a medical anthropologist, did my PhD in policy. But I love my WAPA friends, so I'm calling you from Salt Lake. But what I'm seeing, through WAPA, I actually received a lot of mentorship from a lot of people there of how to go into evaluation as a master's of anthropology. And now I work for the Division of Epidemiology at University of Utah and the VA, so the Veteran Affairs Administration. Right. And what they loved is I could translate both worlds. So I can work in both academia and evaluation. And what we're seeing, at least at the VA level, is this interest in being able to have a foot in both worlds. So the VA is now starting evaluation centers, and our VA has been targeted as one because there's expertise on site that know how to do evaluation. So I'm one of those people. But I have to have a CV for evaluation and a CV for academia. Mm-hmm. And I have to have both. And I think that's an important thing to recognize. And interestingly, now there actually are PhD programs in evaluation. So there's competition now for those of us that came from the grassroots that didn't exist before. So there's about 4 or 5 universities that offer PhDs in evaluation. The American Evaluation Association has record of all those. I'm part of that world, but then I also stay part of Society for Applied Anthropology and other worlds to transition. But I think it's important to recognize that as anthropologists, we have skills that can translate multiple dimensions, right? So it's not just transdisciplinary, but it's even like different ways that research is approached and ways that we can address social issues and give our voice and our perspective and our epistemology, which helps. I think it helps keep people honest, right? I think anthropology helps keep people honest and keep things like evaluation to the people and for the people. So it's fun to have this conversation because we're literally applying to become a national center of evaluation at the VA, but I'll also have to stay in epidemiology doing research that's academic and then doing some evaluation work. So I think this is a very timely conversation. I'm very grateful for WAPA for hosting tonight. So thank you.
Thank you. Anybody else? Neil, you're being visible. Do you have something to say? Oh, you're still on mute.
Neil still here?
Yeah.
Hmm.
Anybody else? Anything to say?
Oh, there's Neil.
Let me add one thing.
Okay.
Thinking about it in terms of methods, one thing that first off, about evaluation programs and PhD programs, I have my doubts about that. As one of the founding members of the Evaluation Research Society and the AEA, I'm not sure you can train people as evaluators as such without having some other disciplinary basis, background behind it. But I guess you can, but I'm a little worried what kind of evaluators those people would be. But one thing that anthropologists tend to add that other social scientists tend to value less is an emphasis on direct observation and participant observation. Could be either. Because one of the things I found in doing evaluations is just sitting and watching as programs are implemented is often a really important first step in figuring out what the questions are. Because you really, again, it goes back to my doctoral fieldwork. I read about all these Canadian social action economic development programs in Ottawa and St. John's before I went out to Newfoundland. And they all sounded like very different from what they looked like when I looked at them in my little village when they actually affected people. They just work differently. And when you sit in a program, it often raises questions that are really important. And I think it's sometimes hard to convince people of that, but once they see anthropologists at work in terms of just asking the hard questions, even if they're not the ones that answer them, it often has a lot of payoff. And I think that's really important. Just a thought.
Great. Thank you. Okay, anybody else on anything else? Neil, you want to unmute yourself? You're still muted. Or maybe I can unmute you.
No.
Okay.
There you go.
Okay.
Oh, hi. I have been fascinated by everything everybody's had to say. I mean, it's just some great skill sets here. And, if we knew all this stuff 30 years ago, we'd be much better at what we all do. It's really important, and I can't stress this enough, is that several of you talked about being able to listen. Suspending your conversations, your internal monologue, and listen to what people are telling you. And so many people that go out in the field and work in communities are there to tell them what's right and what's wrong, how to make change, how to make their world better, rather than listening to them and saying, so how would you do this? Where do you go? Who's important to you? And to me, that's a hallmark of anthropology. You go back to our grandparents, our great-grandparents in the discipline. Those are the kinds of questions they began with. And we're kind of the products of all that thinking and that work. And when talking about what we're doing, I find myself just fascinated by, God, I've got another question for you. Tell me about what somebody said. And that's the enthralling part about anthropology across all of these ideas, is that there are great stories out there. It's just a matter of getting up in front of policymakers and funders and saying, here's what we can tell you. Here's what we know. And here are the people who will confirm that for you. Just go and talk with them. So thank you all.
Okay, anybody else? Martha.
I don't want to be a downer after Neil. But I actually have a concern that we're still not able to communicate what we do to the public. Somebody joked with me when I said, oh, I went into research during the last pandemic, and she said, oh, you mean 1918, the flu? And I said, no, the AIDS pandemic. And we developed so much knowledge about how to, as Neil said, listen to people, how to meet communities where they were at, how to use, properly utilize opinion leaders and things of that sort. And it hasn't been happening this past year. At least not to a large degree. There were news reports and actually some really wonderful uptick in vaccination among Latino communities, at least here in Montgomery County. But overall, people are sort of tearing their hair out. And it's great. I benefited by having mass vaccinations early last spring, but it's very frustrating that nobody thought systematically way back a year ago into how we were going to roll out vaccinations and meet the needs of people who are, I'm going to say, the vaccine hesitant, or those who just don't have time or don't really understand. And that's just an in-your-face example. But in my professional career, I saw it in loads of places. And especially in chronic disease and behavior change. So I just wonder why it is that we cannot get our voice out there.
I think it was political, partly. This has been the whole COVID response has been very technology driven. And there's been very little social science at all. I'm not sure that the people who were in power, who were in charge of putting the response together, those scientists are not social scientists, not behavioral scientists. They're immunologists, epidemiologists, not social epidemiologists even, I don't think. So to me, that's what's been lacking through all of it.
Yeah, I think, part of what I saw is we weren't even positioned to be on the transition team.
No.
And you're right. It was people who came from biomedical science or epidemiology and God bless Dr. Fauci. I adore him like everybody else right now. But even so, and I, God willing, the 4 years before that were an aberration. I don't think they were, but I hope they were. I just think we have not been getting our knowledge out there for 20 or 30 years. We have learned so much in the past 30 years.
Yeah.
And it's still in the New York Times, you look at the science section and it's like a big discovery that you need to talk to people about vaccination in a way that makes sense to that person. It's like, we just figured that out last week,
Yeah.
So there's some way that we are still using a model where we just talk to each other.
I think
Not sure how to break that barrier.
Neil?
Part of the problem there is that the organizations, AAA, SFAA, talk about anticipatory anthropology. What you're talking about is anticipatory public policy anthropology, but actually getting into the trenches and making the connections and making networks, nurturing them over time, being available, but starting to think about what's the next challenge going to be. And we rolled through HIV, to Ebola, to pick a series of diseases that were all seen as one-up. And if people had been on top of their game back at the beginning of the Ebola crisis, you could have rolled from HIV into that. We started out working in refugee resettlement in the early 80s.
Sure.
The thing that struck me was the number of people that went from refugee resettlement to HIV/AIDS. Number of anthropologists. We traced lineages and networks back to places people worked and said, in Minneapolis, there are people shooting up, there are people trading sex for drugs. And I know that because the refugee community I work in is in the same place. The knowledge and the networking ability is within all of these groups. You just have to look forward and invest the time in doing that, in contrast to what our meetings do for us, which I'd argue very little for us, but for the people that actually go and believe in them as important, that's where the energy gets wasted, because nobody stops and says, how do you move this forward? How do you take these topics like we're talking about now and make them central to the discipline? So I think that's why WAPA is so critical, that it has the ability to make these conversations central and hold it for time. I think NAPA can join that conversation. I think High Plains can join us in this conversation, but it takes an investment from organizations and time to sit and have these opportunities. And I'm sorry I'm fuzzy. I don't know what's going on with my camera, but it's California.
Yep. Yep. Good point. Isaac.
Yeah, I think one of the real challenges here is, ironically, it ties back to the idea of value and what people value in terms of credible insights. You know, every few years, we watch this happen in, like, you know, Silicon Valley, when it comes to, you know, suddenly these guys who are doing machine learning realize, oh, maybe we should consult some people who actually do social science. But it takes, you know, like 5 years of a project collapsing progressively before they realize that, oh, you know, we've built these, you know, motion sensitive cameras that can't detect people with darker skin. And we didn't know it because we never had any black people in the lab with us when we were developing them. And, you know, I mean, this happens over and over again. And I think, you know, even Matt Stoffel makes a question here about, you know, impacting, you know, data wrangling and machine learning. And, you know, it's the whole garbage in, garbage out. And people just love to feed garbage in, and they have these like preset ideas. You know, I've been on projects where, looking at what USAID did in a country, and we had to come to the conclusion painfully that if they had just taken that money and handed it out to people in stacks of cash, it would have done more than what they spent just sending us to figure out if it worked, much less what they spent on the project itself. You know, so I mean, yeah, I don't have an answer. I'm just ranting, you know.
It's 9:04. I'm gonna spin this slightly differently, see what others have to say, and then see if folks are ready to wrap up. You know, I'm listening to this and I'm seeing both sides. You know, on the other hand, one hand, anthropological approaches, they may not be called anthropology, have spread, I think, to a certain extent to a lot of other disciplines, and particularly the sort of professional disciplines, so public health, social work, et cetera, et cetera, et cetera. So we see more of what we like in these folks. Although sometimes I think it's, you know, ethnography light and, oh, gee, you're not quite getting it. But, you know, I know from my experience, you know, I finished in '88. I wanted to do applied stuff from the beginning, even though everybody thought, you know, you couldn't be very bright if you did that, but hey, we're not going to go there. And, you know, I learned very quickly that I don't call myself an anthropologist unless I'm working with, you know, people who know what that is, because, you know, you get pigeonholed into something else. You call yourself a social scientist, right? And so I think there's more of us out there that are part of teams and doing this kind of work. And, you know, that's why you see multi-methods on everything, because somebody has gotten the memo. So my question is, you know, I haven't gone to a core anthropology meeting in years because it doesn't speak to me, right? So how is it that we, as applied anthropologists, you know, who do work interdisciplinary, most of us, right? How do we change this? How do we, as Martha says, get into the seats of power so that we're at the table with the design on this? And I think many of us have done this. Suzanne, you did this for years, right? And Andrea, yes. And unfortunately, I'm not seeing all of the chat, so I'm wondering if people can say it out loud. So let me open up the floor and sort of see if anybody has anything to say on this. And
with
yeah.
Andrea, Matt, and Elena have been chatting about this, so maybe they want to just jump in.
Yeah.
Let me just read my question real quick, just for the video in the audience. So what role or impact can anthropologists play in new data wrangling and analyzation technologies like machine learning, natural language processing, neural nets, and other things coming out of the computer science world? And how can we integrate anthropological thinking into the implementation of those technologies within evaluation?
So a recommendation, because I've been delving into this a bit, because I don't want to get left behind, is I've been doing a Coursera program from out of University of California on computational social science. And I think I would highly recommend even just doing the intro course on Coursera, because you will see everything that's available, what they're working on, and what they're not good at, which is when we have computer programmers, have some stereotypes there, exploring social problems with computational methods, they miss a lot. And again, it was like Isaac said, garbage in, garbage out. And they desperately need brilliant social scientists to work with them to know about what to put in, what to explore, how to explore it, what's missing, what are strengths, what are supplementary pieces of data. So what's cool is the technology is newer than I really thought it was. So this is a point where you can still get a grasp on what it does and then link up with some computational social science researchers to work with them and develop some pretty cool projects.
We've worked with some of those people in the DC metro area, different universities and consulting firms. And one of the conundrums they keep running into with us is that we ask questions they don't have answers to, and they run away from them because it doesn't fit into the structure they're creating. But it requires you to back up and think about base concerns, base questions, and who it is you're really talking with. That's just good anthropology, I think.
I'm actually presenting at AMIA, so the American Medical Informatics Association. I'll probably be one of the only qualitative people there in San Diego in 3 weeks on a method that we developed at our VA. I was the only anthropologist, and it was with a group of NLP and machine learning analysts. And we were hired by a group that were working to address an executive order of the president and analyze a large body of unstructured qualitative data collected to address veteran suicide. And so what my role was to help the NLP analysts understand what words they might be missing in looking at regular algorithms and understanding patterns that they might want to look for. And we did a lot of joint coding. So I learned a system that they used so I could joint code with the NLP analyst. And we even sat side by side so we could speed the process up, because we had 3 months to turn around a report on over 9,000 free text responses. Mm-hmm. And that would have taken me more than a year to do on my own. And so we've started writing up the method, and we just recently presented it for the VA, and I'm presenting it in AMIA, and we're trying to get it published in Qualitative Health Research right now to really put it out there that these are complementary. Like NLP uses a lot of sense making and a lot of other theories that we actually use in anthropology, but they don't quite know how to apply it in the same way because they're not social scientists, right? Mm-hmm. So then when you work collaboratively with them, the great gift of being an anthropologist is you can give them the human side of why would I ask for that word versus the common word. Like, why would I ask you to look for expletives in that data? Because they're mad at the VA and they're going to be swearing in their open-ended responses. And when we found the expletives, we found all this data and they were like, whoa, we didn't expect to find this. I'm like, oh yeah, like veterans for venting, right? And I'm like, those are the ones we need to listen to. But it was a really challenging process for me. I had to get through a lot of my own struggles with not following a more traditional qualitative method. And I really had to grow through the process and learn I don't think we need to learn all that technology. It's about like, they have the skill. I don't need to learn it. I just need to know enough about what they're doing to give them the tools to find what I need. When I'm the qualitative analyst on the project, I just need to give them enough so they can find the data for me and pull it for me. But I'd love to talk to this group about that method later at another time, if that's ever an opportunity. But it was fun. It's still challenging. We're trying it again on a new one. So on an evaluation that we're doing. So.
Great, thank you. Anybody, any last words? We've got a couple minutes.
We don't got a couple minutes.
Well, I could just add, I've been looking at what anthropologists are doing in energy, and they have been getting a voice. Laura Nader has had a voice for quite some time, getting on various commissions. Shirley Fisk, by being on involved with supporting a senator, and various anthropologists have been writing for the Atomic Energy Journal. There are avenues for voice in a more public way that we could pursue in our various areas to get the voice out more directly than just amongst ourselves.
Great, thank you. And I think on that note, I think we should probably bring it to a close. Yeah. So thanks again to all of you and everyone in the audience who C. Crane, is that clapping? Kathleen? Yes.
Yes.
Okay. Yeah, so thanks to everybody. And next time, Martha, what do we have next time?
Next time we are going to be, I don't have all the details yet, but it looks like we will be having a program on returning of artifacts with speaker from the State Department. And then the following month, Matt is Matt's baby, and that one will be looking at, I think, a similar issue among Indigenous communities.
All right.
Okay.
All right. Well, thanks everybody. And
Thanks everybody.
see you soon. Good
Great,
to see
great.
everybody on Zoom.
Thank
Great
you
presentation.
all.
Thank you.
Wonderful.
Yes,
Thank you.
All right.
Bye-bye.
Thank you. Bye-bye.